Everybody stand for the Pledge of Allegiance.
Yep.
Oh man, I knew I should have wore pants.
I pledge allegiance to the flag
of the United States of America and to the republic
for
for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay, I was requested to ask if we could to add to our agenda tonight an item for discussion and consideration of funds for the EMT graduation program supplies. Do we need a motion on that? Am I correct?
Yeah.
Okay.
You need a motion to add the item to the agenda.
Right. Can someone give me a motion,
All
please?
right, I make a motion to add that item that Diane just mentioned to the agenda.
Okay. Any discussion on it?
I'll second it. I don't know if you need a second, but
Yeah. Oh, thanks, Jeff. Any discussion on it? Okay. Okay. Let's vote on it. All in favor, say aye.
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 Any opposed or negated? No. Okay. Motion passes. All right. Let's get into it. Public comment. I see no public. So I guess that's not going to happen. Past minutes, approval of commission meetings from June 23rd. Does anybody have any comments or questions or any problem with it?
Nope.
No.
Thank you for getting it out so quickly.
Yeah, it was really quick.
Yes.
Yeah, that was awesome. It gave us plenty of time to digest it. Did a really good job.
Yeah.
All right. No comments, no questions? Okay, can I have a motion to pass them?
Yeah. I'll make a motion to approve the
Second.
minutes.
And seconded?
Second.
Second, okay. All in favor say aye.
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 Anybody opposed or negated on it? Okay, neutral rather. All right, Chief's report. You're on, Lee.
All right, it's me. Pick me. I'm going to go really fast. Pandemic response. The only big change is I have joined the Connecticut Advisory Board subcommittee, which is just kind of interesting. It's a COVID-19 subcommittee. And we're kind of breaking out into smaller groups and just trying to come up with.
You had all that extra time, right?
Hmm?
You had all that extra time for that.
Yes, I was super excited, and then somehow I'm on, I think, 3 of the subcommittees, but lots of good people to meet and network with for Trumbull, and so we'll see how that goes.
For Trumbull to network, not to leave Trumbull, right?
Right.
No.
Very clear about that.
No. I have a plan. I'm leaving Trumbull for a beach to retire. That's my plan.
I
I might have just like one stop over in like DC, somewhere where Medicare makes the rules, so I can change some of them. But other than that, so that's really it. On the pandemic front for us, we saw 3 weeks where we had 0 positive transports. We're just starting to see another trickle again. So the last 2 weeks, we've had 1% of our calls come back positive, and a very minor increase in our PUI transport. So I think the numbers are fairly low still, but the predictions, based on the smaller scale kind of mapping and surveillance that we're doing, still show that we might be seeing a surge as early as the end of this month, not this month, the end of August. So I think initially we were looking at in October for our big surge. Right now the numbers are trending a little bit more to it hitting right as Matt tries to open the schools.
Yeah.
Good luck. I don't think but I don't know. I mean, they're just predictors at this point. We don't know if it's actually going to happen, but it's just based on the various stats that I'm trying to follow. So we're trying to keep really, really prepared. We're in pretty good shape with PPE. We're actually working with the town to try to store them elsewhere. My biggest concern is purely temperature regulation. Like, it's just so hot in the Bay, and those N95 masks and straps are just going to degrade. So they're working really hard with us to try to move us to just move the supplies to a secure and temperature controlled environment. So
how about that new building on right next to the town garage?
They were there, but then it got commandeered back by Public Works, I believe. So they're looking at the Helen Plum building right now, I believe.
Oh, that's a good building. There's plenty of room there.
So, or this whole new building for EMS.
Oh, that's
I just keep throwing it out there. One day someone's going to be like, good idea. But So that's that. That's really where we're up to. I'm incredibly proud of the team. They are continuing to really step up. Very, very rarely that I'm having to go out there and ask people to put their mask on. And usually when I am, it's a new vendor or staff member that doesn't seem to take it as seriously as our crews. Our crews are taking it really seriously, which is great because definitely a couple of our neighboring EMS agencies just had outbreaks. So they're all doing what they're supposed to do with the masks and the PPE and the keeping everything clean. So that's that. That's
Excellent.
for the month.
Okay, old business?
Community engagement. I'm sorry, Diane, what?
No, go ahead. Finish your report. I thought you were done. Go ahead, finish.
Sorry, that was just the pandemic report, but I'm speeding along.
No, you're doing good.
You can read it all. The community report is what it is. We do lots of good things, lots of good support, online support stuff. EMT class is graduating on Thursday night. We will be Facebook live streaming the event for those of you who want to watch, simply because we are trying to follow social distancing guidelines, but we are hosting a graduation in the bay, so it's an indoor-outdoor event, kind of spreading out, that allows the students' families to at least come down. So we'll stream that. This class has been really phenomenal. I've really got to give credit to our faculty, Shannon Pranger, Jackie Rizzatelli, Ellen Mullen, Kate Sadlier. They put together this unbelievable program. We've switched over to this online learning platform that really is kind of setting these students up to succeed, because they're doing a bunch of work before they're even stepping into the classroom. The simulation that we've done to replace a lot of the clinicals is second to none. It's been great. All credit to the students too, just a really great class. I think there's 16 or 17, and they're all killing it. They take these online exams, like they're timed exams, so they can't really, they've got a limited time to do it in, but we give them like a time, to, go home, and you've got till midnight, you've got to start the exam. Once you start the exam, it's timed. They get home, and within like 15 minutes, they're logging on, they're taking the exams, and they're doing really well. So that's great. Our winter class, we just had our first 3 students take the practical exams. All 3 passed all 5 stations first attempt, which is really incredible, because that was really their class got, I guess, thrown the most COVID hurdle, so to speak. So super impressed with them. Clinically, we had Dr. Cicero from Yale come down and do a simulation water event. We offered it out to the whole region because it was outdoors, so we had paramedics from around the whole state. Fantastic for recruiting, by the way, and fantastic little mini interviews as they all did their patient scenarios, and I stood back and watched A, how they did clinically, and B, how they were interacting with the doctor and the staff from Yale and Connecticut EMS Council. Police dive team, Trumbull Police dive team came down and joined us. They did a phenomenal job, took us out on the boat. We did simulated rescues of patients that were either drownings or not even drownings, but just somebody out on the water having an asthma attack, that kind of thing. Really, that was a really great day. We hosted 3 pediatric education for providers, and we did ACLS for experienced providers. And so far, so good. Nobody got COVID. I'm feeling slightly less panicked about bringing people back in the building. So we'll see if we can keep that up. We're just about to introduce some more of our classes, again, our CME classes for August. And we got a lot of compliments. I put one in here. I wanted to say thank you again for the excellent program the other day. Please add me to your list of CMEs. I'm really pleased with the program quality that your department is giving. That's coming from one of the head paramedics who's the head of training for another agency in the region. So I think the people are enjoying the quality and the caliber of the speakers that are coming in. Stats for the year, we came in less than, I think, around 300 calls less than we did last year, which I actually think is really quite incredible considering the amount of call volume that we dropped since February. I was thinking it might actually be worse, but it really wasn't so much. I think the big thing you can see is our transport rate dropped to 69% when last year it was 77. And again, that is, we had a huge, you can see the last few months how that dropped down into the 60s because obviously we had such a huge decrease from the pandemic. I'm still trying to do a big marketing push and public relations push to try to get people to feel comfortable and safe calling 911, because I am fearful that we're still seeing a lot of people that are waiting until it's too late. before they call us. And we're definitely still seeing those cardiac arrests presumption rate a little higher than it has been. So I'm going to try to do another thing. I'm talking to the town about potentially like a kind of a town hall again, where we just encourage them to talk about the signs and symptoms and why they should feel safe calling 911 and going into the ED. So yeah, that was that. I don't know if you have any questions on the yearly call analysis at all.
Oh, Lee, I have a question. Is that trend the same, or like Monroe, Fairfield, or other towns, kind of trending down?
So most other towns. So I actually have a regional service chief meeting every Friday. I just didn't go last Friday because I took the week off, but everybody's seeing the same thing. They're seeing just a big decrease in call volume, big decrease in transport rate, and decrease again in their billing, because we're billing a lot more BLS versus advanced. Bear in mind, our whole protocol has changed. You know, all the calls that are our bread and butter, CPAP and nebulizer treatments, it's just a thing of the past at the moment. You know, so whilst those patients are still obviously transported, still treated as priorities with a paramedic on board, we're not billing at that paramedic level for, you know, advanced interventions if we're not really able to provide them. So we're working hard on our billing, and we're still in pretty good shape. And again, you know, it's probably better if I send it to you. Like I can send you, I've done a billing analysis that I can send you still in draft form, and you'll be able to see like the trends month by month. But we are working, we've got care stimulus package that went in that will be put entirely towards offsetting revenue loss from the minute of COVID, the pandemic is declared. We have set up to bill for uninsured patients. So any patients that are uninsured, that are transported for any COVID-like symptoms during the COVID period, we can actually go through the healthcare stimulus fund thing that we set up. And we'll most likely, that call will be covered at the same rates as a Medicare or Medicaid call by that fund. And there's another thing that just came out, and I haven't even had a chance to look at it today, but there's a webinar on it tomorrow with my billing company and some other thing that looks related to revenue recovery for this. So, I mean, I think that everybody is seeing it here regionally. I was actually, like, I went to the Pinnacle online thing as well. I've kind of had it in the background for the last 2 days. And a lot of that focus is on fiscal recovery from this. And there were people from around the country all saying the same thing. Or big agencies, little agencies, they're all seeing the exact same trends. Right now, you know, touch in all the wood that I can find, we still covered our operating budget, which is really good. I had hoped to go way above and beyond our operating budget this year when I did my projections in January prior to this little pandemic, which threw a spanner in the works. But I think it's pretty good that we're definitely, yeah, I'm still waiting because we're still in a billing cycle that's going to get offset, but we've already covered it right now. So we should be even still a little over despite the losses that we're seeing. So
just to step back for a second, if you do the town hall or you're speaking with the community,
yeah,
something else to push is that just because they call 911 doesn't mean they have to go to the hospital. And
yeah,
we're not pushing to get a bunch of RMAs, but it puts our foot through the door.
yeah,
And allows us to see people, because we've been pushing that over in New York, it allows us to see people that we really need to convince to go, or at a minimum start treating and then get them to go, because we're seeing the same thing. It's, you know, we're seeing people that should have called 3 weeks before, and now they're in sepsis or you know, they're just in real end stage of a condition that should never have been to that point. So, but a lot of the people, especially the elderly, think that just because they call 911, they've got to go to the hospital.
yeah.
So it's almost like a quasi community paramedic kind of system.
Yeah.
To at least get our foot in the door because they're going to be, I would almost guess, maybe 30% of those people that would, you know, call for that would end up needing to go.
Yeah. No, that's a great idea. I absolutely agree. You know, whatever we can do to just get them to feel comfortable again, it's very important. So.
Joel, Shea Greg here.
I think Shay's coming in.
And I'll echo that. Is can you hear me, guys?
We can hear you.
Guys hear me?
Can't see you.
Yep. I'm incognito. I'm in the car. So, A couple things. One, we have seen tremendous drops in ER volume, like way below budget. And we continue to see those drops in the ER volume. So we see what you see on the front lines as what's going on. And the other thing of note is we are seeing later stage disease. So we are seeing a lot more perforated appendicitis. We're seeing a lot more incarcerated hernias that are actually starting to strangulate. And whatever you can do in the communities, like Joel said, to get into those houses and, make contact and, try to get those people to the hospital earlier. We're seeing a lot sicker disease than we need to. Some of it is actually delays because they couldn't get surgeries done beforehand, especially when it comes to the hernias. I mean, I cannot believe how many incarcerated and strangulated hernias we've done over the last 3 weeks. I've done 4. My partner's done 5. I've got another partner that's done 2 or 3. It's just insane. So, yes, the word that needs to get out there is if you wear a mask, you wash your hands, you socially distance, you're going to be perfectly fine when it comes to COVID. And I mean, I keep talking about the data in our ICU where we've surged to 7 ICUs in Bridgeport, and all those nurses who are wearing masks going in and out of rooms with N95s on, but wearing masks outside the room. Not one of us, not one care practitioner got sick during the surge, and that's in all the ICUs. So again, it tells you that PPE works. It tells you that, the hospitals are safe places to go. And even though I can't get up on the soapbox, my health system won't let me, what I can share with you is that, the hospitals are very safe places, and quite honestly, a lot safer than Stop and Shop. So that's been the message I've been trying to spread. And hopefully we can start to get those people in sooner.
Yeah, I totally agree, Shay. And we're trying really hard. That analogy that you use is actually an analogy that I find myself using a lot. I've had people call, I actually had somebody call that we took their loved one in. They were going to pick them up and they were worried and they wanted to maybe go to a hotel and quarantine them. And I think I used the exact words that I feel that right now, the back of our ambulances and the emergency departments, our local emergency departments are probably safer and healthier than going out to the grocery store. So we're doing our best to try to get that message out there and just promote that, because we are seeing exactly that. It's very sad and it's very worrying to us that people are waiting to call and they're fearful to call. And our numbers are very much mirror yours. Whatever we're doing is working because our workforce has stayed rock solid the entire way through this. We're transporting the really sick, positive patients in this tiny space. And back-to-back calls during the surge, and we still had our providers stay healthy and safe. So I agree with you. It's, what we're doing is working. So hopefully we can get it out.
I've heard this quarantine thing, like you go to the hospital, you quarantine for 2 weeks. Let's really, that's just a load, a huge load. Whatever we can do to sort of dispel that. If you go to the hospital where you have to, quarantine for 2 weeks in a hotel, that's fake news. Yeah. So, whatever we can do to sort of dispel that rumor, we've got to really try to get that community outreach out there.
We had, the towns had great response with their town halls, and I did one with them, or a couple of them at the beginning, and then they've done a few more. They're focusing on different things, but I just sent an email out today just to see if we can look at doing another one that's based on just this. I'm going to try to put a different flyer out again, and maybe even also try to look at some sort of marketing PR. I know Yale did a great video on why it's safe to come in and the signs and symptoms. So we might look at trying to do a local version of that and just push that out a little bit. I did do a talk for the senior center, and I included a lot of that, but the audience was small. I think it was like a Zoom online thing, and we really had probably only 6 people that signed in. They were very engaged, but I don't think they were the target audience that were too scared to call 911. So I'm hoping that the community-wide town hall will give us a better options.
Okay. Any more? All right, Chief.
So last thing on my chief's report is a staffing update, and I am going to keep it brief. My biggest suggestion would be to figure out some sort of subcommittee who's going to be involved in the interview process, and then try to see about working. I don't know whether there's a way to work offline or something, but because obviously we can't discuss all the candidates in the public session prior to interviews because, well, I guess we just can't. So kind of want to figure that out. We were able to post the paramedic positions, 3 positions. It was a very short posting because it took a while to get them onto the human resources portal. But once we got them up, we received over 40 applications. I believe I currently have 42 applications in total for the 3 positions. I'm really happy with the caliber of candidates that we have. I'm really happy that we have, for all 3 positions, we have at least, I think the supervisor positions, we have 10 applicants, approximately. I think the full-time medics, we have about 13 to 15 applicants, and then about 22 or so for the per diem. So what I've tried to already just kind of put them into a spreadsheet and do some sort of really quick pre-screen. Do you have a Connecticut license? Do you have current sponsor hospital medical control? Would you need to get medical control? Years of experience, kind of that. Do you meet the requirements, like for the supervisor? Do you have 2 years in or out? Because we had a few that have applied, but they don't really, they kind of, maybe they can consider it, meeting it because they've been a field training officer, but really they haven't held a supervisory position. So I'm thinking, what would be the best plan for how to get the people who want to be involved together, have a brief look, figure out from that the most fair strategy to decide who to interview and how many. And then we just need to look at scheduling, because ideally we need to get these interviews done early next week so that we can make offers and get them through this onboarding process by September 2nd. EMT posting, we were able to put that out last night. That's going to be open for 2 weeks. I've had so much interest for that as well. I don't have it. They haven't sent me the applications over, and I'm trying not to harass the HR department too much by asking for them every day. So I figured I'd ask once a week, and they just download them and send the applications over. So we've got a little bit of time there, but the paramedics, we've really kind of got to put our heads together and come up with a game plan.
I was talking to Lee a little bit while ago, and we thought maybe 3 people to go through all of the applicants. That way we won't have a quorum, but yet we'll have 3 people that are looking at them, and those 3 people that can then come back to the commission and recommend whoever they recommend. Or we can go right through and let the 3 people go all the way through and interview and come back with the one that they want or 2 that they want. How do you want to handle it? I mean, what we were thinking to come up with certain criteria that will eliminate people right away. And then after that, we'd have to go with whatever's on their application as to what's going to be useful for us and how they react and how they work and all that. So what are your thoughts on how we're going to do this?
If we're talking next week, unfortunately, well, fortunately for me, I'm out of town, but unfortunately, for Diane, because I know Diane and I were on the original, we're going to be on the original committee we talked about last month. And then, like I said, town took a little while to get all the apps in. So I'm going to be unavailable next week.
Okay, that's fine.
Yeah.
Go someplace safe though.
Yeah, we're going, going to the Cape. We'll stay in the same spot, and
yeah,
we'll be good.
I am available for whenever. I've been out of work since June 25th and not looking to go back anytime until late August. So I am home and I am free and available for whatever you need.
Okay, that's good to know. So that's 2 of us. Should we draft Phil? Can't do that.
I mean, I can be around. It just depends on the timing. The evenings, everything but Wednesday during the week. So yeah, I mean, I can make myself available.
I mean, so ultimately, once we figure out how many people to interview, I can try to set up blocks, time blocks, and then I don't know, if you guys even wanted to, like, if we do like a quick Zoom to look at the initial setup, and then after that, do you all need to be there for all of them, or if we just say 2 of the committee have to be there, so then if Joel's not available for one night, Jeff's there, like something like that?
Well, we have to, whoever is in the interview process has to be there for the whole thing,
Okay.
because that would make it fair. You can't,
I'll work with the schedule so that we don't have that problem.
All right. I know HR wants to be there as well, which is totally fine. I'm, again, I'm just worried about the scheduling. Like, ultimately, my goal is to try to do this in the first 3 days of the week, so we can then make offers and remake offers if need be, kind of thing.
all right, why don't you try for Monday, Tuesday, and Thursday of next week?
Okay.
And maybe, Jeff, you said you're okay, and Joel, you said you're probably gonna be okay?
Yeah, Monday, Tuesday, Thursday next week, I should be good. Yep.
Yeah,
Is
and
there a time frame? Like, is evenings? Is that what?
Evenings are better for me. I mean,
Yeah.
after 6 or.
All right.
yeah, and I'll do evenings, that's fine.
Yeah,
What-
evenings are better for me.
All
Okay.
right.
So why don't you set up something from like, well, why don't we meet first
Yeah.
after you set up the parameters? Let's,
Okay.
and it doesn't have to be long, but let's meet just to go over everything and then kind of narrow down some people so that we can just hone in on 5 people for interviews instead of 25.
Yeah.
Now, are we doing this based on just reviewing the applications, or are we talking to these people?
No,
Well, no,
we're doing an initial application review, and then we'll talk. And I guess the other question is, are we doing this on, and this is probably a question that I need to direct to the town as much as I need to direct it to you guys, but is this something that we can do in person, or are they going to want us to do it on Zoom?
If we're socially distancing, and there's enough, I mean, the room's big enough.
Yeah.
I mean, I have no problem doing that. Obviously with masks, et cetera.
Yeah.
Okay.
So, I mean, ideally, I think in person for interviewing is quite good.
Yes,
But let me just put it to the administration, because they've got a lot going on at town hall. So
but they don't have to videotape this or do anything like that. So
no, not at all.
we
No,
should be able to
it's just
even,
whether they want to let us people in the building.
Policies and
Quite
procedures,
challenging.
we don't want to create an issue.
well, for the initial one with just the 3 of us or 4 of us,
Oh yeah, well we could do that at our building.
our building, or we can come up here and do it at my house, I
Yeah.
mean, I don't think we're restricted to town
That's
property.
great. We can use his house.
Oh,
Absolutely. Yeah, it'll be free.
Oh, yeah.
Come on by.
All right, so why don't we do that? I'll talk with the town about an interview space, and then I will email Jeff and Joel and Diane, and we'll set up a pre-meeting to look at the applicants.
Okay.
yeah, and then we can screen them and decide how many we want to actually interview.
Yeah, and what we looked at doing is also doubling up. So some of the candidates for paramedic supervisor are also candidates for full-time paramedic,
Okay.
and some of the full-time paramedic candidates are also candidates for per diem. So I do think that there should be 2 interviews, because I think supervisor questions are very different. But I was talking to HR about potentially just anyone who's applying for the supervisor and the paramedic, we just tack on like 2 clinical scenario-based questions to their supervisor interview and consider it 1 interview, and
I mean,
either the super.
that makes sense, because anybody you have as a supervisor should easily be very good at being the medic.
Yeah,
So I don't have a problem
Absolutely.
asking them those type of questions.
absolutely. And then with the other ones as well, the paramedic per diem full-time, it's the same interview. So it's just, once we figure it out.
And Lisa,
And-
she's got some questions that we could possibly use. And that's the
Yeah,
other thing to do.
Chris Simone put together 4 options. They're sitting in my inbox. I haven't looked at them. But like, he put together just like a bunch of mock questions, scenario-based questions that he thought would be good. We have the old questions that we used. And so maybe when we all meet, we can look at those and kind of pick out, just a few, 5 or 6 questions per applicant, maybe.
Sure.
I've learned. See, I'm getting better and better. Smaller is better.
How
Shorter is
about,
better.
how about if we meet, if you set something up for Monday night and get started, and then we'll see where we're going from there and how much longer we're gonna need from there. How does
All
that sound? Does that sound all right, Jeff?
That's good.
give us an idea of where we're going and how long it's gonna take us to do this. And then we can space them out or get them ready. You know, get
Perfect.
HR there. HR doesn't have to be there Monday night. I
No,
don't believe so, just us.
Yeah.
All right, well, see if you can find us a place to meet, otherwise we can come up here, I don't care.
okay,
And then
sounds good.
we'll go through the interviewers and pick out some good ones.
Picking out the best.
I'm very impressed that there's so many people applied.
I'm
Yeah.
super impressed. I'm super impressed. Hypothetically speaking, a neighboring agency that may or may be very similar to us just hired someone full-time and only had 5 applications, of which only 2 were eligible candidates. And they're paying more than us.
Well,
I'm super proud.
everybody needs to work for our chief.
That's right. That's right. It goes right
I'm not
back
kidding.
on our
It's not a joke. That's not a joke.
I appreciate it.
Yeah, for sure.
Been a whirlwind.
Okay, any old business policy rewrite?
So here's what my suggestion is. So the policy rewrite, the bane of my existence, and what did I say, 90 days when I came on that I'd have it done? It's been my one fail, epic fail, but I think I'm there. We're so close. Kate's had a look at it. It's done. What I did is I try to separate it out into like alphabetical order in one document. So when people are looking it up going forward, we would load it on all the iPads in all the ambulances. And so if they're, oh, I crashed the car, oh, injury on duty, who do I call? Obviously legal has to look at it, but I figured if I send it to you guys first, I don't know if you guys want to pick your favorite sections that because it's long and it's tedious and you shouldn't have to read the whole thing in one go, but just kind of give it the once over and give me ideas, suggestions. I really haven't fine-tooth combed it, and I will obviously before it goes live in terms of spelling, grammar, using the word company, agency, department, employee, member, like some of them are a little interchanged as I pulled old policies and pasted them in, but that'll all get done. But it's more just the content. Do I have it all there? What am I missing? Are you comfortable with how it reads? Is there anything that you think is inaccurate, wrong, unfair, too fair? Maybe it's all draft, so I can just shoot an email out to the whole commission tomorrow, and you guys could just kind of give me your thoughts, feedback,
Yeah.
comments.
That would be smart, and just let us peruse through it. And
Yeah.
let's say, do you think next meeting will be too long to wait to get an answer from
Well,
us?
no, as long as it's officially approved by September 2nd when we onboard the team.
Oh, well, that's close.
So we're
Well,
going to
yeah,
hire a
that's
whole
the end
team
of
by then.
August.
So
The end of August, yeah.
yeah, and
Well,
I
send it out and tell everybody that we'd like to have, if they can give us some kind of response, either correct it or do whatever suggestions or whatever, maybe within 2 weeks.
yeah, and the reality is, the good news is about this is it's a working document.
Right.
So even if ultimately we implement it and we continue to update and make a few changes, I'm not printing out paper copies just yet. We'll just have it online, and I can just edit it and update it as we go. Because I think eventually it was just such a mammoth, overwhelming task. I eventually was like, I think I just have to put this out and then really go and fine tune it, because there's just not enough hours in my day, unfortunately. So I'll send it out, and there's definitely 1 or 2 things that I really need the town of Trumbull legal to look at, just things like our driving policy, our insurance, things like that, the compensation structure like that, just to make sure that I'm meeting their criteria. But I'm looking to you guys more for the more like member specific, EMS specific guidance and input. And I'm not married to a single one of these policies, so I will not be offended if you tear it to shreds. I promise you that.
Very good. Okay, any questions on that? Nope. Okay, how about 904 update?
904 is on the road. Hooray!
Yeah.
Everybody loved her. Nobody's going deaf from the siren anymore. We're super excited. Everything went well.
Great.
Awesome.
I don't know when they're coming to pick up old 904, because they really probably want to sell that, but it's waiting for them.
Well, who's waiting for them? The town?
Yeah. Well, we're waiting for the town to take it, because the town normally takes it and then they sell it. So yeah, so it went really well. It went very smoothly. We got approved for the new 903, so they're actually putting the spec together for that, kind of based on this one, and they're able to tweak it slightly. So we'll hope to put that out for an RFQ over the next month.
Now, these are boxes,
Sprinters.
sprinters.
Yeah.
Good. Okay, very good. Staffing update, did we cover that with?
Covered that.
Okay, anything more for old business? All right, new business. We added that one agenda for you.
Yes. So I just wanted to see my faculty have put together this fantastic graduation program, and they've kind of invested a bit of their own funds, purchasing some great things for the students to take home, kind of take home gifts. They included some gift cards for some of our guest instructors that came down and gave really spectacular hands-on kind of classes to the students. And they also bought some supplies to add to our simulation supplies. So I have a few bills that total around 400, rounded up, so a little less than that. And I was just checking in to see if you're comfortable with us using special agency to fund the graduation and EMS supplies for this last class. Some of the supplies obviously will be ongoing into the winter class as well.
Any comments?
Yeah, I'm fine with that. And special agency account, we certainly have funds for it, and we should certainly reimburse people who spent money out of their own pocket and reward those who've gone through the course as well. To see everybody outside every day in their white shirts out there, taking the class. I know it's been hard and hot. I know they were outside doing simulations the other day as well. So congratulations to everybody. What are your plans for, I'm going to say for them? Like, what are you purchasing for them? Is there going to be?
Yeah, so what they've done, I think so we put together these gift bags for them to take home. So part of what we did this year, which was the bags that we talked about, was we actually had Thames Pace supply bags, first in bags for them that we bought, and we bought all trauma shears, blood pressure cuffs, which they earned through the class. So that at the end they've got that, and then at graduation we printed out certificates for them. We made them each a little keychain thing that says Thames Pace on it. And a few other things. They're getting some, like a cake, or I think cupcakes because it's more socially distant, for the students and the parents and the instructors that are invited to the graduation, kind of that sort of thing. They've got these little rubber duck keychains, which I feel like I should explain just because it seems like an odd thing to bill for, but something that came out of the first EMT class that we ran after I took over is we talked to the students a lot about that feeling when you're super overwhelmed, but you're walking in and you're controlling the scene. And so we always tell them, just imagine that you're a duck, and underneath the water, their legs are like really, really fast, but across the pond, they're very, very serene. And that's what we look for as EMS providers, is to come in, and even in that moment when we might actually feel a little like, oh, this is the worst accident, we have to be the duck. So our tradition right now is I buy a big, big yellow rubber duck, which we put a Thames patch on, and all of the students and faculty sign the duck, and it stays in the classroom. And then we give each student a key ring with a little duck on it to remind them. And just, it's just that, it's a feel good, it's a morale boost. I mean, a lot of these students, we're hoping that they're going to come back and volunteer with us, but even if they don't, we're hoping that they share the word about our program, which they clearly have. I mean, we had 5 students in my first EMT class that we ran. And then I think we had 16 the next time. We had 14 the next time. And this class was waitlisted. We would have had probably close to 25, but I shut it down because of COVID. And just trying to keep respectful and mindful of that. And they've been phenomenal. They wear their surgical masks, they clean up, they're always in uniform. When they do their practicals, they put a face shield on. It's 100 degrees out there. And they come in, so it's just really all about celebrating them and celebrating their success, and our faculty instructors' success, and putting out great PR for future classes and hopefully future volunteers.
That's awesome.
It sounds like good use of the money, and
Yeah.
time. Yeah,
Very much so. Definitely reimburse the people that put out.
Yeah, I appreciate, I think we've done it a lot ourselves over the last few times. I think our faculty, that's what they do. They, between us, we all just show up, and it just seems like this is, it seems fair that we reimburse them. They give us so much of their time for free anyway. They really put so much more into the program that I could ever ask them to. So
I definitely agree, but I'm wondering if we can take advantage of this a little bit. What if we did like you know, an advertisement in the Trumbull Times or something about the graduating class, and you know, just so that we could show the community that we're putting more, you know, trained individuals out into the street, and you know that, you know, something, just another thing.
Yeah, no, that would be a great idea. I can reach out to Don Eng at the Trumbull Times and see if he wants to come down and cover it and talk to me or talk to the students and the faculty about it.
And
That would be actually a really, really great idea.
Is this the fourth class?
This is our 4th class, yeah.
I mean, even if we started, you know, going on with, you know, it's our 4th annual EMT class, 5th annual,
Yeah,
your 10th, you know, we do something.
yeah, absolutely. And look, we've obviously done way more of them. These are just my 4. You know,
Sure. We could piggyback on all of them if it, you know, came out even, you know, better or higher or whatever. So, but just maybe just start throwing that around and thinking, you know, how we can, you know, it just puts our name back out there again, you know, and
absolutely.
the public see that, you know, what else we're doing.
Yeah, no, I agree. I mean, and we really are turning students away right now. If I had enough staff right now, I could run a fall class as well. We've actually put in plans with the state for next year to run a winter class, a fall class, and a summer class. But I really have to just get a few more really reliable faculty that I trust with, that are able to commit to the hours. And ultimately, at some point, we need a larger space because we do displace our on-duty crews a lot with the class. But we'll get there. We'll get there. That's all, you know, part of the big picture.
So when is the graduation?
It's on Thursday.
Good.
It's on Thursday. And like I said, we're gonna have, I've got Jackie's figuring it out because for all my cutting and pasting on Instagram, I've never done a Facebook Live, but that's how we're gonna do it. We're gonna have Facebook live stream it so anyone can watch as
Well,
well.
that's good. All right, do we have a motion to, you need a motion for that, am I correct?
Correct.
Do we have a motion to give the funds to Lee for this?
Sure, I'll
purpose?
make a motion. It's been, you say 400's enough?
Yep.
Okay, spend up to $400 for the EMT graduation class and reimbursements.
I'll second.
Okay, any discussion on that? You sure that 400 is enough though?
Yeah, I think it is. We really do. I don't think it's necessary to do more. I mean, we've pretty much spent. It's already all been done. So I added up everything that we had, and it's not even 400. So I think that's great.
Okay.
I think for 500, the instructors could take their spouses out. I'm just saying.
Out to dinner.
For sure.
For 1,000, you can go out drinking.
Yeah.
For 2,000, we can host it at my house.
All right, we have a motion on the floor to give the money to Lee for the reimbursement. Do we have, let's vote on it. All in favor, say aye.
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 Aye. Any opposed? Okay, motion carries. All right, does anybody have anything else to add to new business? Lee, I know I saw your hand up. You're a big girl. Go ahead.
I just wanted to take a moment to congratulate Kate and her fiance Matt. They're expecting their first child in December.
There you go.
All right.
Congratulations.
She gave me 3 months to forgive her.
That's awesome.
Thank you. Thank you.
We're very excited. It's the first. It's going to be Nine O'Bannon, baby Nine O'Bannon. I've already got the T-shirt made. So very excited.
Oh, that's awesome. Good for you.
Congrats to you, Kate.
Yes.
Thank
Kate, are you in your new house right now?
9 days. Not that I have a countdown or anything.
Okay.
9 days. Almost there.
Home stretch.
Good year for you.
Yeah. 2020 hasn't been most people's years, but it's been mine. So I can't complain.
Good for you.
Terrific. That's awesome. All right. Motion to adjourn.
I'll second it.
Who first did it?
Oh, I'll make a motion to adjourn.
There you go. All right, and Joel seconded. All in favor?
Aye.
Aye. Have a
Happy
safe
birthday,
summer.
Diane. Enjoy the time